Got it. Here's the tight 15-minute Hey Jen version. Short sentences, natural pauses, all authentic. Seniors, listen up. Right now, more is changing with your Medicare and Social Security than at any point in recent memory. New laws have already been signed. Billions of dollars in back payments have already gone out. And real money is sitting on the table that most seniors do not even know about. Today I am covering every major change affecting your benefits in 2025 and 2026. Stay with me through the whole video. Every section has something that could directly affect your wallet. Let's get into it. Let's start with your prescription drug costs, because this change is already saving real money for seniors at the pharmacy right now. Under the Inflation Reduction Act, Medicare gained the authority to negotiate drug prices directly with pharmaceutical companies for the first time in Medicare's history. For decades, Medicare was legally banned from doing this. That has changed. Starting January 1st, 2026, the first 10 high-cost Medicare Part D drugs now have negotiated lower prices. On average, out-of-pocket costs for those 10 drugs dropped by about 50% compared to last year. We are talking about medications for blood clots, diabetes, heart failure, arthritis, and other serious conditions that millions of seniors take every single month. More drugs are coming. A second round of 15 additional medications will see lower prices in 2027. A third round is already being negotiated for 2028. This program grows every year. Now here is the other change that is even bigger. There is now a legal cap on what you pay for prescriptions every single year. In 2026, that cap is $2,100 for Medicare Part D enrollees. No matter how many medications you take, you will never pay more than that in a single year. Once you hit the cap, your prescription costs drop to zero for the rest of the year. About 11 million Medicare enrollees are expected to hit that cap this year. And if your income is limited, there is one more thing you need to know about. It is called Medicare Extra Help. It can reduce your drug costs even further every single month. Many seniors who qualify for extra help never apply because nobody told them it exists. Go to Medicare.gov or call 1-800-MEDICARE and ask about extra help today. Action step. Call your Part D plan or ask your pharmacist if your medications are on the 2026 negotiated price list. One call could cut your costs in half. Now let's talk about a law that changed everything for millions of retired public servants. It is called the Social Security Fairness Act. It was signed into law on January 5, 2025. For decades, two provisions in federal law reduced or completely eliminated Social Security benefits for people who worked in certain public sector jobs. Teachers, firefighters, police officers, postal workers, federal employees under the old civil service retirement system. These were people who paid into a public pension instead of Social Security for part of their careers. The first provision was called the Windfall Elimination Provision. It cut monthly Social Security benefits by an average of $350 per month. The second provision was called the Government Pension Offset. It was even more devastating. It reduced spousal and survivor benefits. In many cases, it reduced those benefits all the way to zero. A surviving spouse could be legally entitled to Social Security survivor benefits and receive absolutely nothing because of this provision. Millions of retired public servants fought for decades to get these two provisions repealed. On January 5, 2025, they won. The Social Security Fairness Act permanently eliminated both of them. Over 3.2 million people were affected, and the changes were applied retroactively, back to January 2024. That means affected beneficiaries received a lump sum payment covering all the money they should have received going back to January 2024. As of mid-2025, the Social Security Administration had already sent out over $17 billion in retroactive payments. The average retroactive payment was around $6,700. Monthly benefits were also increased going forward. Some people are now receiving over $1,000 more every single month. If you are a retired teacher, firefighter, police officer, or public employee, check your My Social Security account at ssa.gov right now to see if your benefit was adjusted. If you were never able to collect Social Security or spousal benefits because of the government pension offset, you may now be able to apply and collect for the first time. Do not assume it was handled automatically. Call 1-800-772-1213 and tell them you want to check your eligibility under the Social Security Fairness Act. And one important tax note. If you received a large retroactive payment in 2025, that income is taxable. Talk to a tax professional about a special method called the lump sum election that can reduce the tax impact. Now let's talk about your regular monthly Social Security check. Benefits increased by 2.8% for 2026. That took effect in January. For the average retiree, that is about $56 more per month. That is real money. But here is the honest picture. The COLA formula tracks how younger workers spend money. Gasoline, electronics, work expenses. That is not how seniors spend money. Seniors spend more on health care, medications, housing, and utilities. Those costs rise faster than the formula accounts for. Advocacy groups have been pushing Congress to switch to a formula specifically designed for seniors for years. Research shows that over a 25-year retirement, the difference could exceed $12,000 in lifetime benefits. That fight is ongoing. Stay informed. It matters. Now here is something eating directly into that $56 increase that you need to know about right now. The Medicare Part B premium just hit $202.90 per month in 2026. That is up from $185 last year. An increase of nearly $18 per month. This is the first time the Part B premium has ever exceeded $200. For most people, this premium is automatically deducted from your Social Security check. So your check went up $56 from the COLA. But your Part B premium went up $18. That means the real net gain in your check is closer to $38 per month for most people. The annual Part B deductible also increased to $283, up from $257 last year. For the third straight year, the Medicare Part B premium increased faster than the Social Security COLA percentage. Your Medicare costs are growing faster than your income. On a fixed income, that gap adds up. Here is what you can do. If your income has dropped significantly in recent years due to retirement, the loss of a spouse, or a major life change, you may be able to appeal your Medicare premium. Ask Social Security about filing a life-changing event appeal using Form SSA 44. Also check whether you qualify for a Medicare savings program. These are state programs that help pay your Medicare premiums, deductibles, and copays if your income is limited. Many seniors who qualify are never enrolled because they simply did not know to apply. Call your state health insurance assistance program counselor for free help. Go to shiphelp.org to find one in your state. Now let's talk about dental, vision, and hearing. Because this gap in original Medicare catches so many seniors completely off guard. Original Medicare does not cover routine dental care. It does not cover routine eye exams or glasses. It does not cover hearing aids. This is a serious problem. Untreated gum disease is linked to heart disease and dementia. Vision problems lead to falls. And hearing loss is one of the strongest known risk factors for cognitive decline. These are not vanity services. These are critical health needs. Here is what has changed. Nearly 98% of Medicare Advantage plans now offer some form of dental, vision, and hearing benefits. If you are on a Medicare Advantage plan right now, you very likely have access to benefits you are not using. Starting in 2025, Medicare Advantage plans are now required to send every enrollee a personalized notice in July, listing their unused supplemental benefits. When that notice arrives, do not throw it away. Use those benefits before December 31st. If you are on original Medicare and want dental, vision, or hearing coverage, standalone supplemental plans are available. Federally qualified health centers also offer dental care on a sliding fee scale, regardless of your insurance. Go to Find a Health Center, HRSA.gov, to find one near you. Action step. Call your Medicare plan and ask exactly what dental, vision, and hearing benefits you have available right now before the end of this year. Now let's talk about elder financial fraud, because this is a silent epidemic stealing tens of billions of dollars from American seniors every single year. The FBI consistently ranks elder financial exploitation among the fastest growing crimes in America. Phone calls impersonating the IRS or Medicare, fake investment offers, romance scams targeting isolated widows and widowers, contractors who take a deposit and vanish, and sometimes family members or caregivers exploiting access to a senior's finances. Scammers are sophisticated. They follow every news cycle. Within days of any major news about Social Security or Medicare, fraudulent calls go out to seniors offering to help them claim their benefits. Here are the facts that protect you. The Social Security Administration will never call you demanding immediate action. Never. Medicare will never call asking for your credit card over the phone. Never. No legitimate government agency will ever ask you to pay a fee to access your own benefits. Never. If anyone calls unsolicited asking for your Medicare number, Social Security number, or any form of payment, hang up immediately. Then call the official number yourself. SSA is 1-800-772-1213. Medicare is 1-800-Medicare. To report fraud, call the National Elder Fraud Hotline at 1-833-FRAUD-11. Share that number with every senior you know, before someone needs it. Let's talk about mental health, because millions of seniors need this and almost nobody talks about it openly. Grief, chronic pain, fear of losing independence, the loss of a spouse, depression that sets in quietly after retirement. These are real burdens that millions of older Americans carry every single day. Medicare now permanently covers telehealth mental health services. This is not a temporary pandemic program. It is permanent law. You can see a licensed counselor or therapist by phone or video call from your own home. No driving. No waiting room. No transportation barrier. If you have been putting off getting help, that barrier is now largely gone. Ask your primary care doctor for a mental health referral, or visit Medicare.gov and search for telehealth mental health providers in your area. And if you are a family caregiver spending all your energy caring for someone else, this applies to you too. Use it. Speaking of caregivers, there are an estimated 53 million unpaid family caregivers in the United States right now. Sons, daughters, spouses, people who gave up income and sleep to care for an aging loved one. Most receive almost no financial recognition for what they do. Here is what is available to you. There is a federal tax credit called the Credit for Other Dependents that may apply if you are financially supporting an aging parent. Several states also have their own caregiver tax credits on top of the federal credit. The IRS VITA program offers free tax preparation to seniors and lower-income taxpayers. Go to irs.gov/VITA to find a location near you. Ask specifically about caregiver-related credits. You may be leaving real money on the table every year at tax time. And if you need a break from caregiving, contact your local area agency on aging. Go to eldercare.acl.gov or call 1-800-677-1116. They can connect you with respite care options so you can take time for yourself. Here is your full action list. Every one of these steps is free. 1. Call your Part D drug plan or your pharmacist and ask if your medications are on the 2026 negotiated price list. 2. Go to ssa.gov/extra help and check if you qualify for Medicare Extra Help to reduce your drug costs. 3. Set up your free My Social Security account at ssa.gov/myaccount and check your current benefit amount. 4. If you are a retired teacher, firefighter, police officer, or public employee, call 1-800-772-1213 and ask about the Social Security Fairness Act. Do not assume it was handled automatically. 5. Call your Medicare plan and ask exactly what dental, vision, and hearing benefits you have available before December 31st. 6. Go to medicare.gov/care-compare before choosing any nursing home or care facility. Look at the real inspection and staffing records, not the brochure. 7. Go to shiphelp.org and find a free SHIP counselor in your state. They will help you compare plans and understand your benefits at no cost. 8. If you are a caregiver, go to irs.gov/VITA for free tax help and ask about credits you may qualify for. 9. If anyone contacts you claiming to help you access new benefits and asking for money or personal information up front, hang up. Legitimate government services are always free. Always. 10. Share this video with every senior you love. The laws and programs affecting your retirement are always changing. Benefits that did not exist last year are available today. Billions of dollars in back payments went out to retired public servants who fought for decades to receive them. And costs are rising in ways that require you to stay sharp. Your job is to know what you are entitled to ask the right questions, and to never assume someone else is managing it for you. Because in most cases, nobody is. Knowledge is your most powerful protection. Subscribe so you never miss an update when the laws affecting your retirement change.